When I came through veterinary school, the real intense educational focus was on the gold standard of care. The teaching aspiration was, I need to show you the cutting edge, newest, freshest, best way to do this. And now we're talking a lot more about spectrum of care and access to care and contextualized care. What does a spectrum of care education look like? How is that different than those of us who went through vet school 20, 30 years ago?
I think what brought it home to us was we get a lot of data coming back in from graduates who've been out a few years, and we were recognising from the data that the graduates were struggling with adapting care plans to the realities of life and general practice. That transition into primary care practice, which is where the vast majority of our graduates end up, is that falling off a cliff edge. Suddenly you've got to understand that you can't apply those skills in the way that you've learned them, because that's just not possible. It's not desirable in that context always. So for me, it's been quite painful recognising that the way we've taught for so long isn't doing what we thought it was doing. It's not serving the needs of the student population, or therefore the needs of our employers, our students' employers and the graduates' employers in the public. So we pretty much banned the phrase gold standard. A colleague has talked about golden outcomes rather than gold standard, and that's a nice way of looking at it. But I don't want the students feeling that offering something that isn't textbook is a compromise. It's not a compromise. It's a perfectly acceptable approach. It's where you're using your professional skill set as a veterinarian to sort out the problem in front of you in a way that is acceptable to the family, to you, to the pet. But it's a big shift from gold standard or nothing, which is the way that inadvertently our traditional education systems have set people up.